I want to come back to the initial point you made about the distinction between clinical medicine and public health. And there's always been a divide. And clinical medicine has been seen as the real medicine, and public health is sort of the poor stepchild, or the, not as relevant. But if you look at the history of health and our health gains, most of them have been through public health, whether it's sanitation or clean water, or even things. And I think we really have to look at that seriously. And what really struck me a number of years ago when I went to Haiti and saw what was happening there, and saw how Paul Farmer addressed TB and AIDS, which are infectious diseases, not by better drugs or surgery, more vaccines, but by dealing with the public health issues that he called structural violence, the social, the political, economic conditions that drive disease. And we're seeing that here. We're seeing the structural violence devastating populations from COVID-19 that we discussed, the poor populations, Hispanic, African-American populations, people who have chronic illnesses that are caused by our food system. These are real issues that aren't going away. And I think when we really look at how do we have to address this, it's going to be through changing the structural system, the social determinants we call health, people's ability to access food, to deal with the stresses that they're dealing with. These social determinants are bigger and more relevant determinants of health than any drug or surgery. And then, of course, there's food. I mean, the food system itself has to radically change in order for us to address this pandemic of chronic disease and the burden on the healthcare system. So the only way to do that is by dealing with the public health issues and the clinical issues together. We can no longer separate them.
I think we're going to see precision public health become a major part as important as interventional medicine, and it will help chart future healthcare policy and planning.
Amen to that.